Can you share a particular memorable or impactful experience you've had working in the behavioral health that has shaped your approach to leadership?
I actually started as a therapist intern on the floor and working with children and adolescents. And in that experience, the thing that was the biggest takeaway for me in working with that population is that a lot of those kids had a lot of unresolved trauma. When you're dealing with kids who have a lot of trauma, there's a lot of behaviors that's associated with it. And so what I found is just sitting with them, taking the time to just listen goes a long way. And so that's something that I've tried to ensure that I've carried throughout my career, is really making sure that I lead with compassion.
Probably being in a facility like this, just observing the way the patients are at their worst and how much we can do to improve their lives by treating them with dignity and respect, by being courteous, by doing good teamwork and keeping them safe, how they can come such a long way in just a few days with medications and the proper treatment.
Yeah, so that is every day. I am a clinician, first and foremost. And one of the things that I have found, regardless of the age of the person that I'm working with, is that the most profound learning comes through experiential learning. And so I try my best to put people that I work with directly as a clinician through an experience that is transformative. And that shapes my leadership style, which I consider to be transformative leadership. And that is leading others to find and align with their purpose and values, and let that be the driving force behind the work that they do.
And one of the things that really impacted me when I would interact with those families is that you don't always, what you see is not always what you get. The impact that that had on me is to always try to be compassionate, try to look below the behavior, both with families and with patients, and actually look at what is going on here, what's happening with this person below all these behaviors that we're seeing.
I actually came into contact with an employee who was a PRN, and it was my first director job. She was just really coming into the field kind of late, and she was looking for someone to really recognize her, and kind of sitting down and taking the time to get to know her and speak to her and help guide her. She ended up being an amazing employee, but she really touched me as a director to help me understand that being in leadership was more than just, it's not about managing people, it's about leading people, it's about listening to them.
Being able to come in and actually have an immediate impact on staffing, even wages comparison to our competitors, but more importantly, being able to help train and develop our directors.
I was previously a therapist here, so I already saw the buy-in of our patients. Like, you know, if we just give them time and space to kind of just let them recover and process what's going on through their life, that it works. They do actually get better. And one of our patients shared that, you know, seeing, you know, someone step in, like a director, or even meeting with our doctor earlier this day, made her feel like cared for. She actually felt like a person in our care rather than just a patient. And she started crying, and it was really impactful. Like, it was one of those moments I didn't even realize the impact of what we were doing.
But I worked at another facility, and there was one particular family with a young man. He was like 22 years old, and he first had his psychotic break. And mom is a single mom, and she was so heartbroken. I was able to help provide her with resources. I helped her understand what the doctor was saying. She was just so thankful. She called me once the patient was discharged. She called me every week to give me an update as to how he was doing and just to thank me for helping her.
So a patient once told me, we were just processing, talking, and he said, you know, my family is labeling me as a drug addict, and they're blaming everything on drugs. And I think it was really impactful to me, because the stigma is always like, oh, well, they're having mental health issues because they're drug users, instead of looking at it in the frame of mind that, you know, they turned to drugs because of mental health issues before that ever occurred. So it really put into perspective for me on my view of our patients or people needing help. So it kind of led me to lead in a sense of understanding and compassion.
Me kind of going to my leadership and, needing some help. My aunt had been diagnosed with cancer. We found out she was in ICU. My supervisor never looked up from her screen, kept working, basically said, well, what is this going to look like? Like I was putting the facility out in some way by having a tragedy in my family. And so I decided at that moment in time that this was probably not the kind of leadership style that I was able to work for or deal with. And my aunt passed away before we got to see her. So I rooted in and said, I'm going to have compassion for my employees and the people that I am chosen to lead.
It's helping both staff and patients create insights into like their own issues or what can make their issues better or solutions, and just that aha moment. And you can see that brightness and that light like in the middle of a session. And sometimes you don't always get it in this environment because it's short-term crisis acute, but every now and then you do. And it just kind of reminds you, like, this is why I'm here.
And I worked with a kiddo who in particular was 4 years old. And I just remember that his experience in the CPS system and his behaviors on the unit made him really challenging for some people to work with, but he was always really excited to see me. And just, I've learned from working with patients, especially kids like him, that having empathy for all kinds of patients is really important.
I wouldn't say that is in a particular one. It's just not to lose sight of why we're here.
It's been incredible for me to see in the last few years that I've been here how synergistic we can be across departments. So I've seen some really incredible work from nursing with patients. I've seen breakthroughs through clinical. I've seen medical staff come in with some of the most acute cases and person discharges in a whole new state.